Hi, my name is Dr. Stephen Charlap. I'm going to talk today about diagnosis and misdiagnosis, topics that are very near and dear to my heart. Why? My brother was a practicing cardiologist, and he lost his life to a misdiagnosis. My dear friend, my wife's best friend, also a physician, lost her life to a misdiagnosis. And around the same time, I almost lost my own life to a misdiagnosis. All three of us are physicians, or were physicians. If physicians cannot protect themselves against misdiagnosis, who can? Well, according to the U.S. Institute of Medicine, no one can, because it predicts that everyone will experience a misdiagnosis at some point in their life. The burden of misdiagnosis literally takes a life or causes permanent disability virtually every 42 seconds in the United States. You would think that a problem that cost the U.S. healthcare system nearly $1 trillion would get attention, but it barely does, because that $1 trillion would come out of the pocket of doctors and out of health systems. There is no financial incentive to really clear up misdiagnosis. Now, don't get me wrong. I'm not suggesting that doctors purposely misdiagnose you. But when they only have 15 to 20 minutes for an appointment, there's not much more they can do than focus on the problem that you present with. And we are taught in medical school, I'm a physician if I haven't mentioned that when you hear hoofbeats, think of horses, not zebras. That admonishment is basically telling you, think about the most common disease first, before you think about something unusual. Well, that's great, because 60% of the time, it really is probably something common. A cold, a flu, could be type 2 diabetes, which is common, could be a heart problem, unfortunately it could be cancer. These are relatively common problems. And again, 60% of the time, doctors are going to figure it out, give or take. Another 10% of the time, it could be about 250 other diseases that doctors deal with. The problem is the last 30% of the time. You see, 30% of the time, doctors can't get the right diagnosis. And when I say doctors, primary care doctors. So they refer to specialists, but 21% of the time when they refer to specialists, it's an inappropriate referral. So after you've waited weeks to get the referral, you end up going to the wrong specialist, who then has to either refer you back to your primary care doctor, who then has to come up with a second referral, or might even suggest a different doctor at that point. Why does misdiagnosis happen? Okay? I've studied this topic for 12 years since my brother passed away, including 3.5 years at Stanford, 2 years at Harvard, 2 years as a principal investigator for the National Institutes of Health, 2 years as a co-investigator with the National Health Service in the United Kingdom. And the answers are relatively simple, but complicated. The first reason for misdiagnosis is an inadequate history. In a 15-minute or 20-minute physician session, there simply isn't enough time to ask about everything. There isn't enough time for the patient to remember everything they wanted to tell the doctor. And so from the doctor's perspective, because 60% of the time it is something straightforward, they're going to come up with a straightforward answer. If they're really confident, they may treat it based on what they believe. If they're not as confident, they'll order testing to try to affirm what they think is the right diagnosis. And when the results come back and it isn't what they think it is, well, then they will extend in the next session further consideration. So biases, confirmation biases, based on 60% of the time it tends to be 50 different diseases, leads doctors to what's called premature closure, which means they stop thinking about other things it may be sooner than appropriate. Now, what does that mean? It means doctors, when they confront a set of symptoms, they think of the various diagnoses that could be involved. That's called a differential diagnosis. And it's usually a relatively short list because they're not sitting there trying to think of every last thing it may be. They're trying to think about the most common things it may be. And so, either because of their bias of other patients they've seen that day, or the diseases they see most commonly, or because of a lack of time, or because it's later in the day and they're tired, they don't think of certain diagnoses, and they don't have the time to pursue other diagnoses, so they come up with a short list, and again, 60% of the time, they're right. But you wouldn't get on a plane if 60% of the time it flew okay. You wouldn't buy a refrigerator if 60% of the time it worked okay. But in medicine, you go to the doctor because 60% of the time they get it right. Now, why is it difficult to get it right? Because, as I mentioned, there are common diseases with common presentations. I've seen this 1,000 times. I know exactly what it is. Boom, the doctor nails it, okay? But what about common diseases with atypical presentations? Every human being is a little bit different. You may react differently to the same disease as someone else. And so if you present to the doctor with an atypical presentation, they're going to think of what's common to that presentation, not think of the common disease that this may be atypical. Then, of course, we have uncommon diseases. Uncommon means less than 1 in 100 people get this disease. And then finally, we have 11,000 rare diseases. So let's break this down again. If your average doctor spends 60% of the time on 50 conditions, 70% of the time on 250 conditions, okay, the remaining 30% of the time over a 30-year career might expose them to 1,000 or so plus or minus diseases. There are 28,000 diseases. So it is highly probable that your primary care physician, over the course of their career, sees less than 5% of all conditions. They don't even know the names of thousands of conditions. They've never seen it, they've never learned about it, they've never had a patient with it. And so it's virtually impossible for them to even think about what you might have if it's a rare disease, or it's an uncommon disease, or it's a common disease with an atypical presentation. The other problem that doctors sometimes make is they fail to order the right test. Okay? Again, if you didn't think of a diagnosis that could be made with a certain test, then you're not going to think about the test that you need to make that diagnosis. Another reason is failure to make the right referral to a specialist. They think this is something they can handle themselves. Now look, I'm going to tell you something, and I don't want you to misinterpret what I'm saying. Doctors don't have a financial incentive to prevent disease, catch it early, or diagnose it the first time. It doesn't mean that they purposely don't try to do that, but prevention takes time. Early detection means that you have to sometimes pick up on signals before symptoms, which means subtle changes, which requires lots of questions to be asked to recognize subtle changes. You see, you may go to a doctor for 30 years, but if every appointment is 15 to 20 minutes, they never really get to know you in depth. They only get to know you each of those short appointments, okay? And it's not enough time to ever go deeply with you. I'm going to share a personal anecdote. When I ran my preventive medicine clinic, primary prevention medical clinic, I used to spend on average 90 minutes with every patient who walked in the door, okay? There was an incredible phenomenon. Somewhere around 40-something minutes, patients who were typically 65 or older would say, "Doc, I just told you something I never told any other doctor. And I would immediately look at the clock on the wall, and it would confirm we were into over 40 minutes of conversation. It took 40 plus minutes of continuous conversation for people to open up and say, I just told you something I never told another doctor. Think about that. 65 or older, 75, 85 patients who have been going to doctors for years just told a virtual stranger who spent at least 40 something minutes with them something they never told another doctor. It's one of the big problems in medicine because we're taught in medical school to do this comprehensive intake that typically takes 45 minutes to an hour. But in real practice, there's no time to do any interview that lasts more than a handful of minutes. Because in the appointment, there's a handful of minutes asking you questions. There's a handful of minutes doing a physical exam. There's a handful of minutes thinking about what you have, writing up the chart, writing up the orders for tests, imaging, etc. Add that up and that's 12, 15, 20 minutes. So there isn't time to really dig deep into your story. And even if you've been coming to this doctor for years and they know on the surface you have diabetes, okay? You have some gout, you have some rheumatoid arthritis, whatever it may be, they don't have time to remember all these details about you because they see a couple of thousand plus patients a year. So misdiagnosis happens for cognitive reasons, which is intellectual processing of information. It happens for knowledge reasons. The doctors simply don't have the full knowledge of medical literature. Interesting enough, the founder of the Mayo Clinic 150 plus years ago said that medical knowledge already exceeds human intellectual capacity. 150 years ago. And there are 2 million studies that, give or take, are published every year. So in 150 years, over 300 million more studies were published, give or take. Nobody can keep up with it. Okay? Why am I telling you all this? Because we now have something called AI. And I'm sure you've heard AI hallucinates. I'm sure you've heard AI leaves things out. Okay? It's true, particularly in the earlier models. But AI can do things that doctors can't do. It can think of every single possible diagnosis in the world. Okay? It can spend as much time as you want to spend with it sharing your history. It can stop and think about, after it collects your history and collects information from you, what you might have and what additional questions it wants to ask you to make sure that it didn't miss anything. It can think of one diagnosis. It can think of 27 different diagnoses. There's no such thing as premature closure of consideration. Okay? AI can help your doctor because 2 studies, one done in the United States, one done in the United Kingdom, showed that before the doctor speaks to you about why you came to see him or her that day, if you hand them a list of possible diagnoses, you make them 8 to 12% more accurate in their own diagnostic abilities. However, if you give them that at the end of the process, no benefit. Why? Confirmation bias. They look at what they think you have, they look at the list, and if they see it on the list, they say, there, I nailed it. Okay? So it doesn't work after the fact, but it's unbelievably effective before the fact. 8 to 12% more accurate is a big deal. Now, I mentioned the Mayo Clinic. 20% of patients who go to the Mayo Clinic walk away without a diagnosis. And you're getting to see, when you get there, all kind of experts. Why is that? Because they're still human doctors, okay? And each one starts the history from scratch. And so they're asking you the same questions. And they're giving you some extra time. But again, they're all isolated, siloed experts. Now, sometimes they get together and they discuss the case, and they still can't figure out what you have. Those cases usually come down to genetic mutations when they can't figure out. And to know your possible genetic mutation causing your disease, they need to have a whole genome sequence. They need to have checked your entire genetic profile to know if you have any unusual mutations. And this is particularly true in diagnosing difficult to diagnose cases for children, okay, where their symptoms have been missed or ignored as they are developing, and we need a genetic profile to understand and explain what might be going on. So let me quickly summarize again what we discussed today. Diagnosis happens because doctors don't do proper risk assessments. Diagnosis happens because doctors don't get a complete history. Misdiagnosis happens because the doctor prematurely closed off the consideration of other possible diagnoses. It happens because they don't order the right tests. It happens because they don't make the right referrals. It happens in the afternoon because they're tired, distracted, not as conscientious as they were in the morning. So one takeaway is go to the doctor in the morning. They are more likely to get the right diagnosis and do the right things by you than they are in the afternoon. Okay? My name is Dr. Stephen Charlap. I am the CEO of Medom.ai. Medom.ai has built the world's most advanced diagnosis engine. We have the perfect medical interviewer that spends a considerable amount of time with you, asking you questions, allowing you to upload your previous medical records, integrating your wearable data, sharing everything and anything that you think is important to what's going on, and prodding you to answer questions that you may not realize is important to what's going on. It then analyzes it all, takes 5 minutes on the clock to think about what might be going on, and then generates a series of additional questions. After you answer those additional questions, it takes 7 to 30 minutes to rigorously go over your entire case, and it comes up with 5 results. Result number 1 is discrepancies in your record. Anything in your record that doesn't make sense, it flags it and says to you, do you know you said this? Or did you know that your record says this and you said this? It wants to understand why things don't make sense. 2, it flags things in your record that you may not be aware of, but somebody put it in your record. For example, a lawyer I know who did the closing on my house when I sold my house told me that he had a mole removed. Never heard back from the doctor, assumed it was okay. A year later, he's going through his chart. He sees that he was diagnosed with melanoma. They failed to tell him. Literally failed to tell him he had been diagnosed with melanoma. So a year later, he discovers he's been diagnosed with melanoma. Doctors are human, staff are human, mistakes get made, they don't tell you. This application identifies anything in your history that might be relevant that you're not aware of. You might also have a test result that's abnormal that nobody ever dealt with, like this biopsy leading to melanoma. The application, in its third capability, flags any abnormal results that don't seem to have been addressed. The fourth thing it does, it looks at your medication safety issue. Medication safety in US medicine, pretty much true across the world, is 2 medications that shouldn't go together. We have a lot of databases that say don't prescribe these 2 medications. The minute you add a third medication, there's no products on the market that doctors have access to that allow them to know the third medication is not correct. Well, we built a third medication or supplement that you take. By the way, oftentimes doctors don't ask about your supplements. You don't share that information. They don't even know you're on supplements. Supplements can interfere with test results. They can interfere with prescription, how the medications work, etc. So it's really important to know all your supplements. But nevertheless, we built one with over 2,200 examples. It turns out that I was on one of those triple drug combinations and I stopped one of my drugs, okay? My own application probably saved my life from a brain bleed, Okay. And when I went back to my doctors and I asked them about that third medication that no one ever mentioned before, one said to me, yeah, he knew about it, but he didn't think of it. And the other one said, no, he didn't even know. Thank you for letting me know. So they didn't even know that the third drug interferes with the first two drugs and makes their effects much more potent that could increase the fact that I was going to bleed out. Okay? So I not only tell people about what I built, but I use it myself, and it potentially saved my life. Okay? The fifth thing Medome.ai does, it generates a list of possible diagnoses. It generates the appropriate workup based on those diagnoses. It generates treatment based on each of those possible diagnoses. And that treatment includes treatments that you don't necessarily have to go to a doctor for. And then finally, not part of the analysis, but part of supporting you go to the doctor, it generates a list of questions for you to ask the doctor so you come into the appointment prepared. And when you go to the appointment, it has the capability to allow you to record the conversation with the doctor, which, by the way, in 37 states, you don't even need the permission of the doctor to record them. It allows you to record the conversation with the doctor because it is said that 60 to 80% of what a doctor tells you during a medical appointment is forgotten by the time you get to the car or the train or the bus or whatever way you're getting home, okay? And so you get a transcript of the entire medical appointment, which is also great for older people who need to report back to family members. And it analyzes not just based on the appointment alone, but based on your entire medical history that it already knows whether the doctor gave you the best possible advice, and flags when it thinks the doctor did not give you the best possible advice and tells you what to do. This is what Medome.ai can do for you. This is what 12 years of effort and over $6 million on development costs, including money from the National Institutes of Health, Stanford, Harvard, National Health Service, is allowed us to build. And we price it ridiculously low. $120 for a year. Imagine you go to an emergency room because you're not feeling well and suddenly you have to recall all the medications you're on, all the surgeries you've had, all the diagnoses you've ever had, okay? In a life and death situation, you push a button, now they have your entire report ready to go. If not for you, for your parents, for your family member, okay? Again, Medome, Medome.ai. Take a look at it. 7-day free trial. My phone number is on the website. Yep, my one and only phone number is on the website. If you have a problem with this application, call me personally. Just text me first, tell me who you are, why you're contacting me, because I get a lot of spam calls, and I will call you back promptly. Again, my name is Dr. Stephen Charlap. I hope this session today helps you understand why doctors make mistakes, how difficult it is sometimes to get the right diagnosis, why the financial incentives are not aligned in the best interest of the patient, and why now there is something you can use to put you on a more even keel with your doctor so you don't get misdiagnosed. Thank you. Take care.